Hello. We are group number 44. We're at the Saskatoon site, and today's date is February 7th, 2020. My name is Aravana. I'm joined here with Ada, Jessica, Lalo, and Shukri. Our Canadian nursing leaders are Patricia King and Wanda Martin. We chose to look inwards because we have nursing leaders right here at the University of Saskatchewan who are contributing greatly into the nursing profession. When you think of servanthood, what do you envision? Servanthood is not about position or skill. It is actually about an attitude. You undoubtedly have met people in service positions who have poor attitude towards servanthood. Just as you can sense when a worker doesn't want to help people, you can easily detect whether a leader has a servant's heart. The truth is that the best leaders desire to serve others, not themselves. This is a quote from John C. Maxwell's book, Leadership Promises for Every Day. Looking at the outline, we will start with Wanda Martin. We'll talk about her biography, her research interest, leadership styles, and influence on nursing. Patricia King is our next nurse that we will talk about. We'll talk about her biography, inspiration, leadership style, and influence on nursing.
The first leader we will talk about is Wanda Martin. Wanda was born in New Brunswick and later moved to British Columbia with her husband. Prior to starting the nursing program, Wanda and her husband wanted to live a simple life, and they lived in a van for 4 years where she worked as a nanny. While she was working as a nanny, she was inspired by her employer, who was a professor at the University of Victoria, to further her education. She started the nursing program at the age of 35 with a special interest in labor and delivery, with the intent of becoming a midwife someday. But during her schooling years, she was drawn to public health. Wanda received her Bachelor of Science in Nursing at the University of Victoria in a 3-year program. Wanda found research as her main interest, but was faced with some issues with her master's program grants, as they were looking for younger students at the time. She was able to receive a grant for her master's program at the University of Manitoba later on. Her master's research was on perceived risks and surveillance practices of women with a family history of breast cancer. She was later back to British Columbia to do her PhD at the University of Victoria with Dr. Kelly Sajader on various palliative care research projects. Wanda later on moved to Saskatchewan about 5 years ago with her husband and has been the assistant professor for the College of Nursing at the University of Saskatchewan at the Saskatoon campus. Her role of leadership started when she was in her undergrad as a student rep for the College of Nursing. She's also the past president of Saskatchewan Public Health Association, and she's on the board of the Canadian Association of Nurses and Environmental Nurses. Wanda's research interests include public health system research, food security, health equity, and complex adaptive systems. For her public health system research, Wanda worked with the Canadian Institute of Health Research in a funded dissertation. She used situational analysis and concept mapping to look at the way food safety regulation impacts food security initiatives from a complexity science perspective. For food security research, Wanda did her PhD on the intersection of food safety and food security. She questioned how food policies impede food security initiatives. She did case studies on the backyard chicken, farmers market, and raw milk. In Victoria, where she is from, she stated you can have up to 99 chickens in your backyard. This, though, is not allowed in Saskatoon, and she met people who are passionate of sustainable living and worked with them. She got a grant in Urban Agriculture Action Plan. However, some people were against the idea, and she did a survey data on why people are so passionate on either side. This research can be used to understand why people make the health choices they do, such as anti-vaccines. For her health equity research, Wanda predicted that health equity will be a recurring theme in the future, with a focus on reducing health inequity in food. For complex adaptive systems, she questioned how we build resilient communities in the face of climate change and health effects of climate change. What's Wanda's leadership style? Wanda's leadership style incorporates trait theory and situational theory. Leadership trait theory attempts to distinguish leaders from other people and identify universal characteristics of leadership. Wanda states that she's a quiet and only speaks when there is something important to contribute. She's also the first child and took up leadership at a young age. Wanda also uses situational theory to demonstrate her leadership. If she recognizes a need, she tends to try to solve it. She doesn't wait for a team of people to convince her to come along for a ride. She looks out to what needs to be done and invites people in. When asked what made her want to be a nursing leader, Wanda stated that as a student, she attended the Canadian Nursing Association conference and she was inspired. She wanted to be a part of the leadership and on that stage of the conference someday. She has a pride and passion for nursing and believes that if you are committed, there comes a time you will be called to lead. What does leadership mean to Wanda? She states that a good leader has a vision to enhance people's quality of life, engage people in conversations to understand multiple perspectives, deciding and moving forward in the face of unpleasant opposition. How has she influenced Canadian nursing history? She has done so by educating and shaping the future of Canadian nurses. She's also worked in research on food security, health equity, public health systems, and complex adaptive system. She has also published works including 8 articles and 1 chapter book, Conversations in Food Studies, Working the Edge. She is the past president of Saskatchewan Public Health Association. She also revitalized the association when it was dormant. She is also on the board of Canadian Association of Nurses and Environmental Nurses.
The next nurse we will be talking about is Patricia King. She goes by Tish or Nurse Tish. She has been a nurse for almost 31 years and a teacher for 25 plus years, mostly part-time, but now she is a full-time faculty member at the U of S. She has always wanted to be a teacher and believes she was born to be a teacher. The inspiration came when she was at Memorial University. She felt that some of her teachers' approaches were autocratic. She thought there is a respectful way to get your message across to students without being autocratic. This would give her the opportunity to use creativity in her practice. She was born in Eastern Canada to a middle-class family where she is the youngest of 4. She has Irish heritage, and her family is tight-knit, inter- and codependent on one another. Her mother was a stay-at-home mom, and she respects her mother's decision. When she was in grade 10, she went to a Catholic high school run by nuns. She completed her Bachelor of Science in Nursing at Memorial University in St. John's, Newfoundland. She was the first person in her family to go to and graduate from university. In her second to third year of nursing school, her dad was diagnosed with leukemia. She married her high school sweetheart, who was an orthopedic surgeon. They have 3 sons. After graduation, she began working in PICU and became a charge nurse within 6 months. Her husband gained his medical residency in Saskatoon, so they moved to Saskatoon together. She started working at the University Hospital in ICU, CCU, PICU, and NICU units. While working there, she felt the work was very task-oriented. She became disillusioned by what she saw and considered leaving the profession to become an interior decorator. In that contemplative crisis, she had a decision to make about her career and decided to do her master's at the U of S. There, she found answers to what she thought nursing and leadership should be. During her master's, she found interest in community health, which is more upstream, more empowering, and towards wellness. Was inspired to become a leader for a couple of reasons. The first one, while she was in high school, women were encouraged to be teachers or mothers. At this time, an administrator had told her that girls just don't do science. That frustrated her, so she decided to become a nurse. Also, in her 2nd to 3rd years of nursing school, her dad was diagnosed with leukemia. During that time, she nursed him and even gave him home chemo. At that time, she had an epiphany about service. Tish says, "My dad is really the reason I'm a nurse." When we talk about her leadership styles, Tish stated that servant leadership and authentic leadership resonated more with her. Servant leadership is similar to transformational leadership. However, servant leaders are more likely than transformational leaders to demonstrate the natural inclination to serve marginalized people. Central to servant leadership are voluntary submission, authentic self, covenantal relationship, and responsible morality. Tish states that the extent of your influence depends on the depth of your care for others. Authentic leaders are defined as individuals who have a deep awareness of their own and others' values or perspectives, and the context in which they operate, and are positive in their outlook. Authentic leadership is characterized by positive moral perspective, self-awareness, and self-regulation. These qualities of authentic leadership align with servant leadership. Patricia King helped develop school-based community partnerships, such as the Safe Ship, the Yaya Sisterhood, and the Shine program. The Safe Ship program is a school-based community health improvement project started by Tish. This project opens opportunities for nursing students to gain insight in community health, and it provides a safe space for youth to express themselves and to feel comfortable to share their thoughts. This project engages youth and helps build relationships between nursing students and youth. Tish started the Yaya Sisterhood because she noticed a significant disconnect between mothers and their daughters. She saw frustration and animosity between them. She even noticed broken relationships. Nursing students, and Tish created the reflection book called Celebrating Change, Girls' Voices Matter, for their coming of age. This book was published and sold. Over $50,000 of the proceeds was donated to the Saskatchewan Cancer Agency. Some of the students who helped create the Yaya Sisterhood are now nurses. Shine. Shine stands for School Help Initiative with Nursing Education. Shine engages senior nursing students under the direction of a University of Saskatchewan instructor in the delivery of health promotion programming for students. This program takes a comprehensive, holistic, and integrated approach to school health. The goal of the Shine program were developed in collaboration with Patricia King's nursing students, the Shine program coordinator, students, teachers, staff, and parents. One of the major projects from the Shine program was a cannabis awareness for adolescents. In 2018, Tish was awarded the Excellence in Nursing Education. Global influence. The Queen Elizabeth Scholarship allows nursing students to travel internationally and gain intercultural exchanges, education, and professional experience. Some of Tish's nursing students applied for the Queen Elizabeth Scholarship. They went to Uganda and do their community placements. The proceeds of the Yaya Sisterhood was used to buy menstrual products for women in the community, allowing them to go to school when they were on their periods.
In conclusion, Tish and Wanda continue to demonstrate great leadership skills in their own ways and styles. Both Tish and Wanda emphasize the importance of authenticity and community leadership. Tish and Wanda's work in education, research, and publication have gone beyond Canada and globally. Their contribution to the nursing profession is evident in the College of Nursing here in Saskatoon, and they have both taught the future nursing leaders the emphasis in community nursing. As a future nursing leader, it is important to be true to yourself and be authentic to influence and create change. A leader is one who knows the way, goes the way, and shows the way.